Is there a protocol you're placing patients on to just improve the therapy as a whole? Let's say, again, going to PRP, you could put them on papaya seed extract, try and increase the number of platelets, certain dietary things you could go for and just maximize the effect of the therapy. Is there anything you're utilizing with patients?
I am, and this is a moving target or as I am finding what works the best, and everyone's a little bit different based on what their goals are. But one of the reasons I love working at the biohack lab, because it brings in all those other modalities that I like. So before, um, ideally, if somebody's inflamed or a, the voltage isn't quite on, we do things initially. So we do some hyperbaric or some CVAC, some PEMF, some red light. Um, we start them on some stem cell activators. Like I'm really a good fan of stem regen.
Mm,
Uh, getting more in circulation. And if somebody even needs a little, depending on what we're our target is or our outcome, they may even need a little bit of that before. Uh, Ideally, also, they're not exposing themselves to other toxins and viruses and stuff around the procedure because you don't want those stem cells confused and trying to clean up shop. Now, granted, we're bringing them to one place, but after that, we still don't want, we want the rest of them to go to those signals as well and not just try to help the SIBO you have going on in your gut or some other
mm,
um, cold that you just picked up. And then I also add peptides and IVs during or the day before. Some of them are clearing up senolytic cells so that your body doesn't have to deal with that. It's basically taking out the trash. You have a clean
mhm.
slate. Afterwards, I'm also a very strong proponent is just these V cells are never in isolation or anything in isolation is going to be effective. You're giving them information.
Mm,
Now you got to say, what do you want to do with it?
mm,
So I can inject it or I can direct it in one place. But if you're, let's say your brain, but if you don't then activate that area, they're just going to be sitting there going, okay, I'm here. You're not
Yeah.
telling them to wake up and to grow stuff. So you stimulate that area. And so whether that is with neurofeedback, whether that is with games, whether that's coordination, it all depends on what the goals are. If in the brain, if it's visual, you want them to look at things, you want them to track things, you want them to look at some depth perception or whatever the goal is. So now that the information's there, let's put it to use and really and so with that, I always like afterwards also more hyperbaric or CVAC,
Mm.
some more peptides, more PMF, all those things that are going to help the cells not clump, help get the signal there, the voltage there. Basically, you've got little babies. Now we have to educate them and train them and protect them and get them to really do what they want to do. So those are the bigger class of things, but it is somewhat in a protocol depending on what their goal is at the time.
Let's talk results. Everyone wants to hear about results. Do you have any notable cases that kind of stick out to you? And of course, I understand at the Biohack Lab, like, a lot of integrated places, you're not just utilizing one therapy alone, and there is a synergy to it. But is there anything that kind of sticks out to you when applying the V cell therapy that, hey, here's what we saw in these types of cases?
The two that I'm most excited about actually didn't get much use of all the other modalities at the time.
Mm,
It couldn't, or it didn't exist, or they don't actually live here. And so they
right.
came to the thing and had to leave. And that was around the heart. Neurologic ones, we've seen some results, but they take more time and they can be very nuanced.
Hmm.
Mm, And I had some harder cases. So, but there's some a lot, but two that are just very subjective and easy are around heart patients. And one, I love this story because I forced her to come see me. She's a colleague of mine. And if you think I work hard, she has even more stress on her. And unfortunately went through the typical medical model and for her hyperthyroidism and a few other things. And so because of the way it happened, she ended up with heart failure
Mm.
and at a young age, and they almost transplant level heart failure. And she's still teaching and in the ER and supporting her family and had some other metabolic things that weren't in her favor. And she really wanted surgery for something. Not that I agreed with it and didn't want it, but they wouldn't clear her because of her heart.
Mm.
she finally was motivated enough to come see me because I was begging her to come before that. And so she finally did because she had an ulterior motive. And one session with V cells, primarily to her heart, and I get a text from her. Now, granted, I'm the one blowing up her phone before, and she volunteers a text to me. She goes, "When's our next session? Our next V cell session?" I'm like, "It's been a month. Okay, when you want, might be a little early." And before I can even get the text out, she sends me a follow-up text of a repeat echo of her heart. And she was about 20% before. She had gone up to 45%. So that means that the heart is able to pump more. And I'm like, "Why did you get an echo so soon? It's been a month." She goes, "Well, my doctor was noticing I wasn't swelling as much and I wasn't wheezing." And he's like, "Well, let's just get an echo."
Hmm.
And the sad part is they cleared her for surgery. She had the surgery. She had a bad outcome from the surgery. So
Mm.
now, but I did give her the second one before, and so she probably would have died otherwise, but she almost did.
Wow.
Um, but the idea that even within a month, and she didn't do much of anything else, a couple other things, her capacity was enormous. She was walking around now. She was breathing comfortably. She wasn't swelling, and her heart was remarkably better. I also did a little bit of her knee just for like a couple seconds, and she's like,
Mm.
"That you did with my," and I didn't inject it, which normally I would. She goes, "That thing you did with my knee, I don't have any pain anymore." She goes, "Why is that?" So that's one. The other one was another heart failure where he would be so tired just washing his hair because of the amount of effort, and there's a lot actually with blood having to go up versus,
Mhm.
and and he would get winded just from a shower. And after one treatment, within even less than a week, his family are having to stop him from overexerting himself walking through the mall.
Wow.
Get tired when he showers anymore. And because he wants to go, 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 he's not going to, know his own.
Mhm.
The only thing that limits us now is his knee pain. He's like, "When am I going to come and do something?" Because I really want to focus on his heart.
Mhm.
I don't have a repeat echo on him yet. I keep telling him to, but that's out of my control. But uh, clinically, he's like a new person. So those are two that have been profound within less than a month type of results. And not everybody gets results that fast. It depends
Yeah.
on either how much kind of we need to work with, um, but because people will still end up getting results months later. But
Yep.
those are two pretty profound ones.